must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show.
Hey, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I am your host, Brandon Powen, and today I have the extreme pleasure of welcoming two very fantastic and very knowledgeable people to talk about the issue of diversity within healthcare and DPT education. As today I have the pleasure of welcoming Dr. Kim Varnado, who is an associate professor and program director at the College of St. Mary's DPT program, along with being the owner of Inquisicare, along with also having Dr. Kim Nixon-Cave, who is the program director of the Doctor of Physical Therapy and Post-Professional Education Associate Professor at Jefferson University. And actually, side note, Stephanie and I actually had the pleasure of meeting these two fine ladies at the 2018 ELC conference. And I'd like to give a personal shout out to Ann Reichacher for actually introducing us in person at the event. So Ann, if you're listening out there, thank you so much for the introduction. And thank you both for, all that you've done for our profession and service throughout the years. And, I get that there's probably some listeners out there who still may not know a little bit more about you. So would you both be willing to give a little bit more background into, who you both are, and along with your stories with how you got involved with education to where you are now?
So to start off, Dr. Nixon-Cave, how about you start with kind of sharing your background and story, and then after that we can follow up with Dr. Varnado if that works.
My background is that I was a clinician for a number of years and then went into education as a director of clinical education at Temple University. And from there got involved with, continued to be on faculties and got involved with diversity initiatives, and increasing diversity within the classroom and amongst faculty. My background is I'm a pediatric board certified specialist, but I've treated patients of all ages. But my clinical love is pediatrics, especially the infants and neonatology. I do qualitative research. Love that part of it. And I also have an advanced master's in neurology from Temple University, and also an education, PhD in education with a sub-minor in subcontinent area in educational psych. I figured after 2 degrees in PT, education was the thing. So it was so that's how I got involved. Once I got on faculty, that's when I pursued my PhD in education. And I think that was the best course for me. As far as diversity, just a lot of initiatives on diversity, educating faculty and admissions individuals about the need for a diverse class and need for diversity in physical therapists. And actually, while at Temple, we've won at least 2 awards from the APTA on recruitment and retention of a diverse class. When I first arrived at Temple, there was 1 student that would be considered from a diverse background. And over the years, we ended up with having 50% of the class was from diverse background. So that was really a big accomplishment. And so every place else that I've been since then, I've tried to work on bringing in students from various backgrounds, especially minority students.
Well, fantastic. I know we'll dive into that a little bit later, but Kim, I know your schedule and what you've been involved with a lot across the country, literally. Would you mind sharing your background and kind of how you've gotten to where you are today?
Thank you. Yes, I started my DPT training at Indiana University, and in 2005 is when I graduated. After that, I practiced in neuro outpatient kind of a day rehab setting where I worked with patients with all types of neurological disorders. And I did that for about a year and a half. And afterwards, I decided that I wanted to find out what setting was more suited for me. So I did some travel work, which brought me to Arizona. I practiced in a variety of settings and eventually settled on that outpatient ortho was more of my speed. So then I went on to do some post-professional training. I completed an orthopedic residency and a manual therapy fellowship program at Kaiser Permanente in Southern California. And after I finished my fellowship program, I was recruited by a faculty member at a developing DPT program in Arizona to come on board as faculty. And I did that for about 7 years, and part of the way through, or probably about 2 years into the program, I decided to go back to school and get a doctorate in health science degree with an education concentration. And after I completed that degree, I went on to do a fellowship program through the American Physical Therapy Association, the Education Leadership Fellowship Program, just to get more training in becoming a leader and learning how to help support faculty as they transition from clinical practice into academia. And outside of really kind of that space, my research interest is looking into faculty development opportunities and ways that we can help really kind of broaden and improve our ability to help provide support for new faculty members as they transition into academia. Also orthopedics, I enjoy, of course. Orthopedics is kind of my first love. I'm a board certified specialist and a fellow of the American Academy of Manual Physical Therapy. And I still practice clinically. I do some work in ergonomic space, working with individuals who work at water distribution dealerships and help them with lifting mechanics and treating people on the spot. So that's pretty much me in a nutshell. I'm a delegate for Arizona. I stay busy. Keeps life interesting.
Man, I will say you both seem very busy with all that going on, but I think it's incredible that you're able to do that and still stay sane. So I appreciate that. Appreciate all that you guys do. And I know getting into the topic of, diversity within PT education, let's start at the beginning here and let's start about talking about what we know from a data standpoint. So knowing that, of course, CAPTE collects this data, what do we know now about what the CAPTE data says when it comes to diversity of physical therapy students and faculty members? And where do we compare and how does this compare to maybe other healthcare professions, to give some context?
Currently, the students, faculty, and leadership in higher education does not match with the population demographics. So if you look at the population demographics, let's say 60% Caucasian, if we look at physical therapy faculty or physical therapists, we pull up the numbers. I tried to make sure that I kind of had all this readily available. If we look at our student body population for Caucasian students, they're about 75%. So population 60%, whereas our student body 75%. If we look at other groups, there's a lack of representation that matches our demographics. So for the U.S. Census, Hispanic population at 18%, our student population for Hispanic and Latino is 6.29%. And for African Americans being 13% of the population, we represent about 3.26%. So just looking at those numbers, currently we're not necessarily matching up with our population demographics. And it becomes even smaller when we begin to look at faculty and even leadership in higher ed.
And I think the point that should be made is that those numbers, instead of improving with all the efforts that are put out to increase the diversity of the class, that those numbers, especially for African American students, have actually gone down in the last several years. As well as it's hard to have high numbers of faculty when you don't have a diverse class of students going into it, because you have PTs who are going on for their PhD. So it's sort of like you got to have the students to get through PT school, and then they will pursue a PhD. But the numbers are small, and actually, for I would say African American and possibly Hispanics, is actually decreasing.
Yeah.
Well, that's really interesting. But, getting that, of course, those are the numbers for PT. How are we looking compared to other healthcare professionals like medicine, nursing, and some of the other big ones?
I was looking at some data on other health professions and such as medicine, and according to the Association of American Medical Colleges, they have had challenges, of course, recruiting students. But what they have done is use stratified acceptances. Like they've done different things to try to recruit those groups to into medical programs, and so it's just not something that we are actually. We're trying, I think, as physical therapy educators to begin to move into that space of holistic admissions. But right now, if we compare this to medicine, they've been doing this for at least 10 years. And we're just kind of now moving into that area of trying to improve the numbers.
To do with the process that we use for admissions. Like Kim said, other professions have actually, especially in medicine, medicine, I know there are universities that clearly have clear initiatives where they can show the increase in the number of students that they're taking in their initiatives for diversity. But we just have not, as a profession, moved. And you'll find pockets of people trying different things. But I know, for instance, like Temple University's medical school, as well as Jefferson, but Temple graduates the highest number of minority physicians in the country. But they have clear initiatives. And, in PT, we just have not come to an agreement as a profession to move away from the traditional way of admitting students.
Well, and apart from those points that you both had mentioned, which certainly seem to be relevant to this issue, what are some of the other reasons that you both feel are contributing to this disparity among lack of diversity in DPT students and ultimately faculty? Like, what are some other reasons that you guys think this is happening?
From my perspective, it could be a number of different reasons. One of the things that I found when I was at Temple really trying to recruit and focused on diversity was figuring out what is the plan. If we wait until the students are in college and decide to expose them and talk to them about a career in physical therapy, that's too late. High school's too late. Middle school's too late. We're talking elementary school because in some cultures, in African-American cultures and some Hispanic cultures, there's only certain professions that you are directed towards, and that is medicine, being a lawyer, being a doctor, a medical doctor, a lawyer, or nursing, or a teacher on some occasions. So students aren't aware of the profession of physical therapy. So exposing them early really makes a difference. And I think there are people who are trying to get and talk about the profession of physical therapy, but a lot of minority students aren't aware of it. The other factor is because there aren't a lot of physical therapists that looks like them, it's just not a lot of understanding that they can do it, that they can be in the profession of physical therapy. So I think there's a lot of reasons why, but I would think it's more of exposure, understanding of what a physical therapist does, and having role models out there or people who they can look to and say, oh, she looks like me, I can also be a physical therapist.
I agree with what Kim has said. I just wanted to add maybe another potential barrier. And this was kind of brought to my attention when just speaking and asking, what are some of the challenges with getting underrepresented minority groups into physical therapy? And what was brought up to me, and I started thinking about this a bit, was just kind of the student loan debt issue. If we have individuals from underrepresented minority groups with strong academic backgrounds, they may choose to pursue other health professions that pay higher wages and they have, still you have student loan debt, but it may be less or it may be comparable to PT tuition. So if I can make more money and still come up with this, if I can make more money and come out with the same amount of student loan debt, why go into physical therapy? And I also think that perhaps having lack of diverse representation in physical therapy education programs. If students don't see faculty that look like them, they may not believe that perhaps they can become physical therapists. I've had a few physical therapy students approach me and say, I was so glad to see you as a professor at my institution, or even having students of color approach me from other health disciplines say that they were happy to see me on campus. So I think representation definitely matters, especially on faculty, to help students feel a bit more welcome and included within that institution.
From that standpoint, I mean, the finances and the cost has been one of the biggest issues that we've heard throughout the podcast since its inception. And I know that there's being a lot of stuff done to kind of talk about that issue and try to help best way to figure that out. But I definitely concur that seems like a very reasonable assumption as one of the big culprits here. But getting off of the numbers here for a second, I'm kind of curious because you both, I've had to obviously go through a lot, and you probably encountered quite a bit of barriers while going through your journeys to get into, academics. Would you guys mind sharing a little bit of the barriers that you each have gone through personally when it comes to diversity throughout your journeys into education?
I would say initially when I was in physical therapy school, it was not really presented to me about the options of becoming a physical therapy faculty member. It was more of really helping to prepare me to be a practitioner. So it wasn't really until my husband, who's an educator, mentioned to me when I was going through my fellowship training and residency training, Kim, you probably would make a good professor. Why don't you consider a career in academia? And I thought, well, I could potentially be a teaching assistant, but I hadn't really thought about or saw myself in a faculty role. And I was really grateful when a faculty member who doesn't look like me reached out to me and asked me to consider a faculty position. And so it wasn't until really stepping into the doors of an academic institution where I began to really see the potential and the possibilities there. So I definitely think having people at least present the idea and provide some support and encouragement definitely goes a long way. So anytime I see a student, I really encourage all students, but I definitely do reach out to students of color and say, we need people like you to consider faculty roles. As it relates to other barriers that I have encountered, I would say when looking at diversity, there are lots of great benefits there. And one of them is that you get to get different perspectives. But one of the challenges, though, is if you have an institution or a department that may not necessarily be open to those different perspectives, that can be a challenge. So I definitely think that is a barrier, just understanding that when you do have members from different groups presenting ideas and as well as even potential problems that can exist on a faculty within a department from a different perspective, that sometimes having those viewpoints may not necessarily be viewed positively, or maybe something that it would take time for faculty to really as a whole come around and actually addressing and seeing that those issues exist. Is not always easy to look at problems, but I think it's helpful to begin to assess what's happening so that you can definitely make some steps towards changing and fixing and creating solutions for problems. But I definitely think you have to be willing to understand and even accept or at least hear those different perspectives. And I would say that sometimes that's not always there.
I think for me, it wasn't a barrier getting into academia. It was sort of the same thing that Kim just stated. I had a mentor. I did my advanced master's, and the chair of my thesis committee became a mentor for me and had talked to me about getting a PhD, but I was in the clinic and thought, nope, this is good for me. And then a position became available as a DCE. She reached out and said, hey, would this be something you're interested in? So I was sort of brought in that way. And she went, to the search committee and said, we need to bring in this person. And so that was an easy transition and limited barriers. And I was fortunate enough to be onto a faculty that was very progressive and interested in diversity issues. The barriers, I think, came once on faculties and getting more involved. Yes, we ended up with 50% of class, but that was with, really working with the faculty, convincing them that we weren't talking about quotas, and getting them to hear, the need for that. I think, referring to what Kim's talking about, sometimes as a minority faculty member, sometimes you feel like you're the only one. And, and Kim can attest this, most of our career, we're the only ones. And sometimes in meetings, you feel looked over. You may have, there may be a discussion and you may have an idea that comes up and it's negated. It's not even understood. 5 minutes later, somebody else says the idea and it's the greatest thing since sliced bread, which is really kind of frustrating. And you want to say, I just said that, but you kind of figure out how to, not let those things bother, because I think it's important for us to be sitting there and reminding them that the world is diverse. The other thing, and Kim and I talked about this earlier, is that by only, the barriers that you face on a faculty by being the only face of color is what's, and Kim can probably talk to this better, is cultural taxation, where because you are the only person of color, every time there's a diversity issue, every committee, every question, we represent every African American, Hispanic, anybody that's diverse, which we can't, obviously. But you pay, it's that tax that you pay for being on it. And it is a barrier to your success because if you're on every committee, it doesn't allow you to pursue other things that you're interested in. And you're sort of in the catch-22 because you feel obligated to be on the committee because now I'm representing all the minorities, but you can't really represent the minorities, but you have to stay on the committee. So you kind of give up something else. And, you start to have a heightened awareness of the position that you're in. And things come up, some of the barriers like are these comments that are made, which, we can talk about what these microaggressions are. And I think sometimes people don't realize, when they say, you really need to be on this committee because we're going to be talking about diversity. Okay, we all come from a diverse background, or, I have this student I really think you should meet and I want you to mentor, or, you can always tell because even without seeing the student, it could be that the student's interested in pediatrics, but that's usually not the case. It's usually a student, where they want you to meet because they assume they have the same experience that I have. So it is the barriers that I face were more once I was on faculty and continue to be on faculty and continue to face those. And I don't think people are really aware of the position that you're in. But like I said, you're in that catch-22. You don't step away. You keep moving forward with hopes that it will change. And, obviously we have seen some change because we keep going. We see more increase in, younger faculty, more students coming in. But I would have to say it is, that's probably the biggest challenge, I think, to that, because you get involved with like admissions and why they should admit students or bringing in faculty for interviews and things like that. And yes, you're representing diversity, but you also hear the negative comments about minority students and minority faculty. So it is an odd place to be in, but I think it's somebody has to be in that place, and it just happens to be us.
Well, I can't tell you how much I appreciate that, because that totally just opened up a box that I had no idea that that's the level it went to. So I really appreciate you sharing that to get that perspective in. And I know we'll dive a little bit more into that avenue in a second here. But before I forget this question, I want to ask you about this. When you both were we both had kind of talked about, cultural competence and kind of understanding those avenues within any kind of setting, whether it be a clinic, an institution, or whatever the location or place may be. Do you both think that how we teach cultural competence in graduate level and education is effective, and why or why not?
I don't think we do a very good job. I think I think they're good intentions, but it's become part of the requirement for accreditation. And I think you're asking people who are culturally incompetent to teach students to be competent, if that makes sense. And so some people interpret cultural competence as I put in a case and I teach about hypertension or diabetes, hypertension, African American, diabetes and alcoholism, Native American, those type of things. And I'm culturally competent. I remember students, coming and talking about how they were frustrated because faculty, having difficulty trying to incorporate cultural competence and dealing with diversity and putting in cases and naming the cases Mr. Bojangle, which, yeah. And so that would be a little insulting, but the instructor doesn't know. I recently had a recent student in medical, she's a medical student, and she was in a class and they were going around, I don't know what the class was, but they were talking about experiences that different groups have had. And they were talking about the Holocaust and how people had those experiences. They were talking about Japanese Americans in internment camps. And so they were going around each student, and she turned to this student from Nigeria and said, so tell us about slavery. And yeah, and it was like, and she was afraid not to answer. And she was insulted, but was afraid to say that to the instructor, because remember, the instructor's in a position of power. So had it been myself or Kim, at this point, we would have said, what do you mean slavery? I wasn't there. What are you talking about? Slavery, and the students from Nigeria didn't have slavery in Nigeria, right? So I think there's a lot of, how can I say, just people faculty trying to teach cultural competence, but just really not understanding how to do it in a way that will allow students to grow and develop. And one of the things I always say, you have to start with the faculty. You have to start instructing and having the faculty go through and become aware. And Kim and I were talking earlier about what is referred to as cultural humility. And that, that seems to be like a new term. I had a faculty member recently say to me, yeah, that's the new buzzword for cultural competence. Well, cultural humility has been around since 1998 or 97. And it's just the next, it's not about being culturally competent, it's being aware that you need to have ongoing learning. It talks about power and privilege and things of that nature. So do I think, to answer the question, I don't think they do it well. I think that's an area that we need to do a lot of thinking about what's the most effective way, not just to meet CAPTE standards. And I told him earlier, I'm thinking of looking at a research project that really tries to get at what are the students coming in with, and what do we do while they're there, and then looking at them after the fact, which will hopefully give us some insight into what's working and are we changing? Are we impacting them? Because you're not going to change someone's necessarily their bias, but how can you help them to work with patients from different backgrounds and not judge them? Because biases, are really ingrained pretty early. But how do you get them to work and understand and move into what we like to talk about, shared decision making with the patient? I don't know if you have anything to add, Kim. I think.
Well, I think you've covered most of it. The only other thing that I was going to add was with the cultural competency piece, with just presenting let's say, demographic information about different diagnoses, you leave out some of those social determinants of health. Like there are structural things within our society to help to contribute to those factors. And without adequately preparing physical therapy students or future clinicians with that information, equipping them with that information, then I don't think that we do justice to helping them better serve those populations.
And if you guys wouldn't mind, just because I know some people might be listening out there who maybe haven't read the CAPTE standards, what specifically does it say, or like what are the absolute requirements that it does have, as you know, regarding this cultural competence piece or cultural humility piece, as you both had mentioned? Like what are the absolute requirements that they absolutely want?
Well, they talk about having students experience working with diverse patient population and being culturally competent. Cultural humility is not mentioned at all. But it's more about understanding people, working with a diverse patient population. I don't think there may be an explicit standard in the
7 Ds. I'm looking it up right now.
7 Ds, where it talks about where you have to show evidence of, cultural competence or working with diverse patients, not diverse diagnosis, but people from different backgrounds. And so, which is an initiative for the APTA. So I think people see that, and just like any other standard, you want to show that you're meeting it, but it doesn't necessarily talk about the quality of that. So, but I do believe that's how it's worded within the CAPTE documents, unless Kim found it.
Yeah, so 7D5, practice in a manner consistent with APTA core values.
Mm-hmm. And also in this evidence 6, where you talking about your curriculum plan and your curriculum, it's part of that as well. So I think that's generally how it's discussed.
Gotcha. And do either of you think that should change? And how should that change if you do think it should be changed?
Should it change? You mean as far as being more explicit or more required?
Yeah.
I don't know if it should change. I mean, I'm glad to see it. I don't know. Go ahead. I
was going to say it needs to be something more than just a checkoff.
Right.
Right. So because they require it, then we need to make sure we have something in here about it. And so typically what you might see is just it being covered in a couple courses, but maybe not something that's fully accepted or appreciated by the entire faculty, where everybody plays a role in making sure that in their course that these issues are at least addressed, or at least that it's a focus of making sure that students understand that when they're connecting with their with their patients, that they have to consider that they may have personal biases, or that they need to begin to address whatever biases they have, so that they're not, coming across in a very judgmental way, or even stepping outside of their own comfort zones. If we consider the students that are coming into PT programs, many of them may not have ever been around people who don't look like them, or perhaps they may come from a different socioeconomic background, and just understanding that not everyone has the same economic resources, or perhaps they are treated differently in society. At least having those conversations, and maybe even having some way of assessing a student's knowledge of that information, and seeing how they're growing, as their thoughts are developing about, just being clinicians and practitioners, and recognizing the different obstacles or challenges that they may face as they're working with patients who come from complex backgrounds, who may have challenges that they personally can't relate to. Like, how do you relate to somebody who has a different experience than you have? I think we need to probably do a better job of preparing students for that reality. And I think it helps when you have faculty who come from different backgrounds, because they can help to present some of those different perspectives. But if you have a faculty that all kind of look the same and have similar experiences, then being able to share that information with students, that information just may not be there.
And I think maybe there's some other areas that CAPTE does a really explicit definition or explicit description of what they're looking for, like interprofessional education.
Mm-hmm.
They took that approach and was very explicit about, what they meant by cultural competence or increasing cultural awareness and things of the nature. That probably would really help.
Yeah, more guidance.
More guidance.
Yeah, no, I think that's a fantastic point on that. And you both had mentioned throughout kind of the episode already some of the challenges with improving diversity in students and faculty members. Of course, if there are any others you guys can think of, feel free to jump on this after I kind of read this question off. But, Kim, you had mentioned, of course, that, getting your numbers to where you are now required that clear initiative and clearly that focus a little bit. If we could we dive in a little bit more into what that looks like and how that's played out to kind of help serve as some helpful action steps that, faculty and program directors can consider implementing to help contribute to their diversity and their students and ultimately future faculty?
Well, I think it kind of starts with what Kim mentioned earlier as looking at the mission and the initiatives of the institution. If it is part of the mission of the institution to have to increase diversity, to have like my institution, diversity and inclusion, those are components of the mission statement. So as I'm developing this program, this DPT program, I'm making sure that those are components of our mission statement, because that's very much what we're committed to as well. And so it makes it easier if it's something that the institution support. Now, thinking about it from a department perspective, like speaking with the department, the physical therapy department, to find out among the faculty, what do you value? Is diversity something that you want? Is that something that you see long term as a goal that will be beneficial for your strategic plan or your initiatives with the program? If it's not, then I think, of course, upfront being honest about that. But if it is, then taking certain steps to look at what are some of the challenges that the faculty may be experiencing that keeps them from having perhaps a more diverse faculty or even a student body. So looking at groupthink dynamics, power dynamics within the faculty, looking at how we assess faculty members when they come in for interviews, making sure that the interview process is consistent and fair. There's a program that is called, let's see, I did some research on this when I presented at ELC. It's at Oregon State University. They have this program called Search Advocates, and it's a 2-day workshop that they put on to help really provide training for not just for faculty members, but for individuals who are in positions where they participate in, let's say, search committees, to help them understand how to identify if they have implicit biases, understand some of the legal implications of not having a fair interview process. What that could actually some of the challenges with that if you don't understand legally what you can and cannot say or do. Also, they help with teaching individuals how to do appropriate screenings when they're looking at candidates. Everything from looking at how you present the job position externally to the actual interview process, and even just really pushing perhaps that search committee to identify if there are any sort of things going on that could potentially be preventing them from recruiting faculty members of color. So that's kind of, and it's open to individuals who are not necessarily affiliated with Oregon State University. You can go for a 2-day workshop, just basically going online to their website and connecting with that group. So there are different things that you can do. They even have questions that they posted online that you can look at to really look at where you are long term as a department and where you want to be, and how do you help recruit individuals to your faculty. Even this can be, I guess, extended even to your admissions process to make sure that you're getting a more diverse population of people coming to your institutions.
Yeah. And I think Kim made a good point that you really have to start with the faculty and their commitment. It can be the mission of the university, but it's that faculty. Are they ready to commit to that, and really educating them and getting, I think that's really important. I mean, I've been asked to go and meet when I was at, because we were able to increase the class diversity so drastically. I've been asked to speak to other faculties over the years. And one of the questions I asked them is, your faculty ready to commit to it? And what are your views about it? And they're like, no, this is our initiative from the university. And I said, I'm sorry, I can't come, because it's really not a good use of my time if faculty aren't willing to commit to hearing, how do you increase it, and about, bringing in faculty and students from diverse backgrounds. It can't just be something that's a directive. It has to be a commitment to the process, to that initiative.
So then follow up to that is, given that, there's probably, if there is a university or, a department that maybe has a little bit of that, they're not maybe that ready to commit. As a program director, if someone who's in maybe a university like that and they want to kind of help plant the seeds, as you will, to help kind of foster that, what are some helpful tips that you'd recommend for a program director in that situation?
In the whole university or in the program?
Probably the program.
Yeah. I think the first thing is to talk to the chair, who could be different than the program director. But I also think having an open discussion with the faculty. I mean, the one thing that you learn, and you probably have heard this over the podcast that you've done, being on the faculty is like being it's political. So you really have to figure out who's on your faculty, and really, talking to them and seeing what the pulse of the, faculty is, and then talking to the chair and bring it up as a point of discussion. I find any issues related to cultural diversity, increasing diversity of faculty or students, it has to be an open and honest discussion. And it's a tough discussion. It really is tough, because nobody wants to be perceived as not wanting people from diverse backgrounds to be on faculty, but you have to be able to have a discussion, because that's the only way we're going to learn and change. So I think starting with that, and then I think for people who may find themselves as a champion, because that's what they will become, it's connecting first within that university of other people who have the same goal, and also connecting with other people like him or other people who are out there looking to, have the same goal and are championing the same initiative, and building that that group of support, be able to come in and be able to, okay, what's the next step? How do I, bring this up? And, deciding on what's the low-hanging fruit? What can I do that's going to be, at least open the conversation and start the conversation? The program I'm at right now, the diversity is not nearly where it should be. And, which is, there's a lot of initiatives and bringing in, there's a university diversity council, and, we have students involved. But sometimes the bureaucracy of a university can get in the way. But finding others who have the same interests, and then, connecting with them, I think, is the best way. And just know that it could be tough, but what is your goal? Set small goals. It's, this thing of not having these big goals that by next year, your class, you're going to have like 10 new, 10 minority students in the class. You start small and figure out what can you accomplish that's going to be positive and illustrate the benefits of having a diverse group. And I think the other thing is, what we have to recognize now is that younger students, younger professionals, their world is diverse. So they're more used to being with, diverse individuals. And I think it can't help but improve their experience. So it's not as foreign to them as it may have been when, as we were, dealing with the.
I was going to add to, I think everything Kim said is spot on. Just to add something else, I think as a program director, it's important that is definitely a priority that you have, if you're trying to change that in your department. If it's just a few faculty members on the side who are pushing this initiative, I don't think that necessarily goes over quite so well as if you had the leader of that team helping to champion those diversity efforts. I think it helps when if the program director is not only approaching the minority faculty member to ask them to help with recruitment efforts, as far as making sure that they're mentoring, students of color, or even serving on, cultural competency committees, but reaching out to faculty members who are not minorities, who actually can mentor students of color, because that should be a shared responsibility. It's not just, if we think about the cultural taxation piece, the program director can actually help to actually protect the faculty of color who are normally overburdened with those responsibilities, but they can also help to share some of that load with faculty members who are who are in the department, who are not minorities, just to make sure that they understand kind of the significance behind it, and that they do play a role in helping to mentor students regardless of color.
I'm curious because one big issue, and you both had kind of touched on this a little bit earlier. I know we haven't gone in really a lot of depth on this next avenue when it comes to this. So of course, looking at student diversity, one of the big things involved in that is, like you had said, the holistic admissions. And of course, knowing that, there is, of course, a school of thought that looks at more the GPA and some of the more objective, certain objective signs, which I can understand how they can have some pros with that. I can also understand the cons that are associated with that as well. So if we could, how can we, if we're talking about a holistic admissions process to really optimally capture the best group that we can, what are some other tips that you would recommend for programs to include in their holistic interview selection process?
Well, I think if you're talking about, aside from interviewing the individual, but learning more about what's important in that for your diverse student, a holistic, like we've been talking about admissions and requirements and things like that. So obviously, I'm all for bringing in students with the grade point average, bringing in students with that meet that academic standard. I don't feel like the GREs are necessary because they do not measure. That's a moment in time. They're very biased. If you look at any of the data, the last time I looked at it's been a few years, but does not represent the population that is assessing. I know at Temple and even at the university I'm at now, we at Temple we adjusted for the GREs, and at that time you could they actually had normative data for different minority groups that you can compare them to themselves, as opposed to compare to just the general population. The program at now, they don't even consider. So I think looking at other avenues and, there's a recommendation. Yes, I think one should be from a PT, but why does it have to be just from a faculty member? Why can't it be someone who may have mentored that student, someone who's important in their life that can compete and comment on their character, who they are, why they would make a good. So I think it's looking more so than the numbers, but looking at, who do we want to welcome into our profession? And so interviewing them, because we know one of the problems, even if they make it to the interview, one of the problems that students face, or a lot of us face, is that when people interview, they favor someone who looks like them. So even though they may say, yes, this person's a good candidate or good student or a good faculty candidate member, they'll say, but I don't know if they're going to be a good fit. It usually comes because they don't feel like they fit with them because, they are more comfortable with and it's not an explicit comfort, but it's a natural thing that happens. And all the literature that you read, that's what happens. People are like, yes, I can relate to this person. So I think it's just really thinking about other ways to get to that affective aspect, or the person as a whole, as opposed to just numbers. The other thing too is, some, not even just minorities, but looking at career individuals or individuals that had to work a while and then go back to school, looking at their academic history. You know, how did they do? You know, a lot of students go to school that freshman year and they party, you know, and they don't do real well. But then they get themselves together, and, you know, I've seen where applications where faculty members say, nope, you know, the student may have the grade point average or whatever, but look at, you know, that semester, and it's like, well, but everybody has the opportunity to grow. So looking at that, that history, and what did they do to rectify that situation? Or were they working while they were taking 2 or 3 things of that, you know, that nature? So I think there's a lot of different things to consider.
I agree. Some other things I was thinking as Kim was speaking was kind of looking at what diversity would bring to the actual class. So sometimes I think the viewpoint is, well, if we increase our numbers, then it's just really benefiting, you know, the minorities that we're bringing on board. But I think if we're trying to adequately prepare future clinicians to work with a diverse patient population, it's important that we have a diverse student body so that they understand how to better interact with people who perhaps don't look like them, to hear different perspectives. And so kind of looking at diversity kind of from a different lens, not that it just benefits those students from those underrepresented minority groups, but it benefits everybody to have that representation on within a student class. So when looking at your class as a whole, maybe we're trying to get some people who were first generation college students, individuals who, as Kim mentioned, may have had leadership roles perhaps in a different way than what's traditionally seen as leadership at other institutions or with other groups. And so considering that individuals who are from underrepresented groups or individuals who are from medically underserved groups, just to help to create that diverse class so that they understand more of some of the challenges that exist within the population. I think it's very difficult to write policies or think about planning for things in the future for groups of individuals if you have no idea of what they experience on a day-to-day basis. And so that's why I think it's so important for not just, you know, students from underrepresented minority groups, but for all students to benefit when you have diversity within the faculty and also within the cohorts. So maybe part of the admissions process, making that a focus. We want to make sure that we do have some leaders in the class. We want to make sure we do have individuals from different backgrounds, because I think that helps to really create a rich learning experience for your students and for your faculty, because we also learn during the process.
I also think to consider, I was at a university where the class was very diverse. And had a number of students. And I would say probably at that university, it was probably more than 50%, just because there was a large Asian population at that university. So diversity wasn't an issue necessarily at that university. But one thing that we found, the value of having a diverse class was also, it was a freshman admit program, but it also had where you could transfer in. And we found that age was a diversity factor, and that it added to the education of all the students to have individuals who were 30 or 40 years old in with students who were 21, 22, you know, and it really made a difference. So sometimes it's not just, yes, we were fortunate enough to have a diverse in ethnicity and race, but also that benefit of having age be in there too. And sometimes that's just as important a factor, because people that are second careers or older bring a different perspective, and that's a form of diversity as well.
I was going to say something else too, that thinking about what Kim mentioned, I think as a faculty, when you're looking at the admissions process and even looking at we're trying to recruit faculty members from underrepresented minority groups, looking at the environment in the department, I think that's important. Sometimes, you know, we may have efforts to recruit people, but we may not have efforts to retain them. Mm-hmm. And so they're both beneficial. And being open and honest, I think probably as a program director, to address issues when they arise, and then maybe even seeking in some cases professional help outside of the department to help address some issues that may come up. I think sometimes as physical therapists, we feel that we may need to try to solve or fix every problem, but I think it's important to consider that, if it's outside of your scope and you need some additional assistance, I think it's important to perhaps look at what's at your institution, what's available administratively to help you with any of those issues that if they arise in your department. So even with students. So I think that making sure the environment is welcoming is also important.
I think, and that's excellent point, because I guess the last couple of years we've had 2 universities integrate, and one of the committees I was obviously asked to serve on was was recruitment and retention of a diverse faculty. And what was striking about it, the same issues that we talk about recruiting and retaining students, were the same issues that faculty face. And how you can recruit someone there into your university, but how do you retain them? Because university, and I don't know the statistics, but there are statistics that say minority faculties or faculty from diverse backgrounds, internet faculty members from international countries or what have you, may not stay because they don't feel like they're welcome. They don't feel like there's support for them. And so it's kind of an interesting situation where the same issues arise for students as they do for faculty. So looking at things like for faculty, giving them a support network of individuals that are from diverse backgrounds, helping them find a community in the area that supports them. Or look, that they can go and be a part of. It's the same thing, that students face. I just had a group of students that formed a Black Student Association because they didn't feel like there was enough representation. But when there's Muslim, there's a lot of different groups, but there isn't a Black Faculty Association or Minority Faculty Association. So it's sort of the same thing. So at every level, we're kind of talking about the same issues, same barriers, same challenges.
Well, yeah, and kind of going off of that, I know, Kim, earlier you had mentioned one of the avenues or resources to help with that workshop at Oregon State. But apart from that, and apart from any of the specific things that you have found, either with APTA or within your own universities or even with colleagues from other universities, what are some of the other resources that you both have found helpful and would recommend to faculty members to help improving with acceptance and retention of students and faculty with diverse backgrounds?
One resource, I'm just trying to think of the things that are readily available that to access. One, I definitely think reaching out to the diversity group within APTA. I forget what's the name of the program. Kim, do you remember the program?
Minority Office.
The Minority Affairs Office. So they have at least 3 events typically, or at least 2 events per year. One at CSM and another at the Education Leadership Conference, where they have these events where people from underrepresented minority groups meet. So that way, it's a good way to network and find out who else is kind of in your boat so that you can kind of develop your own network, even if you don't have that at your own institution. I think sometimes it's helpful to hear other people's experiences, and just so you know that your experience perhaps isn't that odd or unusual, and to think about strategies. Like I reached out to Kim when I met her at a conference. I was a big fan of her work well before I met her. And so when I did meet her, right away I said, would you mind mentoring me? And it's been a really great relationship. At least I feel that it has been. But I think it helps to reach out to people who you find in academia. I have a number of mentors, some that look like me, others that do not. But I think it helps to reach out to find your support network, even if it isn't at your institution. If you don't have it at your institution, looking outside of your department, because sometimes there are other faces that are similar to yours that might be in other departments. So in my prior institution, I had colleagues or friends within the dental medicine program, within veterinary medicine, and we actually together formed a group to help students that were having challenges, within the institution. It was after an event that took place, the Fidel Castillo shooting. A student from podiatry approached me on campus and said, I don't feel safe. And I live in Arizona. And at the time she just said, I just kind of don't feel safe. I don't feel comfortable on campus. Do you mind serving as as an advisor? Or can we start a group so that other people of color kind of can feel safe, a place for us to come together? And so I ended up partnering with other faculty members around the campus to provide that support system for students. And from there, they developed this mentorship pipeline where we were mentoring professional students who were then mentoring students who were trying to get into professional programs, and then they were mentoring high school students to get into professional programs. And so we were trying to create kind of this pipeline of support. So sometimes even small grassroots efforts like that, looking to see who's in your institution, looking outside of your institution to find out who can kind of be your champion or your support system as you're going through some of those challenging experiences, whether it's, microaggressions or just flat out aggression, to make sure that you're able to not only survive, because I think hopefully the plan is to thrive in your environment, and also helping to, I think, mentor individuals sometimes out of difficult situations. Sometimes you have to consider that you may need to go to an institution where it is more welcoming for people who look like you. And so, or just at least they're welcoming to diversity. They have efforts to help improve inclusivity. If that's a mission, perhaps that might be a better place to grow. So, either reaching within your institution, reaching outside of your department, reaching out within your professional association, and then sometimes considering that you may need to go to another institution that may share your personal mission statement.
And I think also asking the question, one of the things about cultural humility when we think about diversity is the concept of privilege. Power. White power is privilege. So, going to those individuals who have the power and asking them, inviting them, and encouraging them to be a resource and support your efforts to address some of the issues that come up. And, I think, like I said, a lot of universities are doing a good job, or they're trying to do a good job. I know at the university I'm at right now, as I said, they have a diversity council, but the university as a whole, when something happens, they allow faculty and students to come together and to voice their concerns. If it's, there's been, some shootings and racial things and things like that, and to come together. The most recent situation with the Muslims shooting in I forget what country it was, but this university allowed the student association to have a prayer service, but also invited people to come and talk about what's going on and what it feels like. So I think going to find that person who is in a position that can make a difference, and partnering with them and going to them and asking them, use them as a resource. This may not be on their agenda, but going to them and talking about why this is important. Because the reality of it is we can try make a push and make changes, but the people in power and who they're going to listen to is not unfortunate, but is that position and that have power. And when you read the literature on cultural humility, it's that white privilege. And so I just gave us a keynote to a DPT program that had no diversity. I think they had one student, and they wanted to learn more. They're very interested into it. And so what I challenged them to do is use that power, use that privilege to make a difference, to increase the diversity. And so, and I don't see that as having that white privilege is a negative. I see it as, how can we use it? And challenge the students to go out and apply that and think about, if this is important to you, think about what power you carry and how you can use that to make a difference.
I think those are some really, really good points. And I know we've talked, a lot about looking at this issue from, an institutional academic standpoint, But now I'm going to say, all right, let's step out of the institution for a little bit and let's kind of go back to ourselves as parents now. Because recognizing that, of course, students and newer, and humans for that matter, receive a lot of input and a lot of ways in which they are shaped are not strictly just institution by themselves, but also a lot of cultural and parental influence with that too. So I guess my follow-up to kind of what we've been talking about is, how would you guys recommend that parents help foster appropriate views of diversity and cultural humility at a young age for their kids, despite the environment that kind of exists as it is now?
I would say the first thing is exposure. The foster, expose them to, diverse individuals, to let them have the experiences, because your views are formed by your experiences, and talking to them about, people from different backgrounds and what does that mean, and what is the, what can they learn from that, making sure that they understand that everyone's equal and the same, and how can you, interact and not see the difference. I mean, fortunately, as I was telling Kim earlier, my boys grew up in an area where it was like a little united nation, to the point where my oldest son came home for Hanukkah and wanted to know why we weren't going to celebrate Hanukkah. And I was like, well, because we don't celebrate Hanukkah, but but he knew all the Hanukkah songs, so it was really an opportunity for him to learn and appreciate different cultures. So I think educating them, because the reality of it is, kids learn what they should be, their views and their biases by the time they're like 5 or 6 years old. So that's really important, to really give them the opportunity to be in a diverse environment, and talk to them about diversity and give them opportunity to experience that.
Yeah, and Kim, how about you? Any thoughts to add into that?
I kind of similar experience. I have a 6-year-old, and so being very intentional and putting her in environments where she has exposure to different ethnic groups, different kids from different racial backgrounds. I think that's important. And also really, sometimes I wonder if some of these things that we're experiencing is because people don't really understand the importance of like self-love, that you are enough. And so sometimes even sharing those little key nuggets of information, like with my daughter, loving herself, loving her appearance, and appreciating other people's differences and how they're beautiful in so many different ways. I think, even though it may sound kind of simple, but I think that's important. When you have a positive self-image and how that is sometimes projected when you communicate with other people, then you can respect their differences, as opposed to if you view yourself negatively, sometimes you tend to view people through that same negative lens. So definitely exposure, I think it's important. Also, as parents, checking your own personal biases. I think that's really helpful. And watching kind of what's being communicated in the household, what you allow to come into your household, what television shows or what songs you allow your children to listen to. I mean, I have to be very, I'm trying to be very aware too of different images that are portrayed if I think that they are not necessarily positive, even if we move beyond race and ethnicity, looking at gender roles and how sometimes that information can definitely negatively shape, someone's perspective about themselves or even their potential as they grow up. So it was so funny. We're playing cards with my daughter, and I just looked. There was like a card deck, old maid. So a woman who's older, who's unmarried, who's not married. Just even some of those negative things that we just kind of grew up listening to or seeing, that can really send a message. And so I'm trying to be very cognizant about stuff like that. I'm probably overboard.
I think also not only exposing them to different cultures and different individuals, also educating them about themselves and their own culture.
Yeah.
That's one of the things that I find that in teaching this, for several years, students don't always know, about their own background. And, I used to ask the question, how many people in here have a culture? And the only people that would raise their hand were the minority students, but they didn't really, necessarily understand their culture, because if you understand your culture, it gives you pride, it gives you a way to represent yourself. And so I think it's really important. The other students, majority students, just assume everybody would live the way they did. And what do you mean culture? Doesn't everybody do everything the way that I do it? So there is that benefit of educating them about their own culture so that they can, represent themselves, feel good about where they come from, as opposed to letting someone else tell them who they are, who they should be. Because then they can have a more honest discussion with individuals from other, backgrounds when they're interacting, and not just, assume that they have to be like them.
Absolutely. And I think part of it in some cases is sometimes even a lack of awareness of who we are and where we come from, because I know people have done looked at their ancestry records, and you think one thing and you were brought up one way, and then you find out, well, maybe not.
Exactly. And that happens more times than we realize. And I think the people who are making the most money is this ancestry group, which I find pretty interesting, that people are doing. And I don't find too many, I find some African Americans that are using it, but I find they do more of the family tree, because there isn't a whole lot of information. Ancestry gives you the DNA. That's what it gives you. But, because there's not a whole lot. But yeah, they find out that, oh, I guess I'm not from Ireland, Actually, I'm from Scotland or whatever, So it's pretty interesting. But you're right. People don't really know. And I think that's really important to educate kids, especially in this day and age. It's really important for kids to have a good self-concept and confidence in who they are.
No, I couldn't agree more. And, I appreciate both of your perspectives today on this topic, because I think we've talked about it from a lot of different angles. So I really appreciate that. I know the listeners do as well. But of course, it wouldn't be one episode without asking our final question that we ask everyone. Now, if you both would like to either say something that you've talked about already tonight to reiterate a point, that's perfectly fine. Or if you want to talk about an issue that's totally different regarding education, feel free. So here's the question. If you could change one aspect of healthcare education, whether that be physical therapy or other healthcare provider related, which aspect would you change, and how would you change it?
Oh, that is a good question. How would I change it? Tim, you have an answer?
Yeah, I've been thinking about this for a minute. One thing that I probably would change is how faculty members are prepared coming into programs, not just DPT programs, but healthcare professionals, how we are brought into the academy. I think it's helpful if you are recruiting faculty members who are very skillful at patient management, because I think it's very difficult to deconstruct the clinical reasoning process for students if you don't have one yourself. So I think it's important that we begin to recruit people who have a very strong understanding of how to appropriately manage patients in an efficient manner, because I think that will help with our future clinicians being able to do the same thing. The other component is I think we need to provide really more support and more training for faculty that move from the clinic into the academic space, because in order, I think, to be an efficient and effective clinician or efficient and effective faculty member, it's important to understand that not only do you have to have mastery of patient management, but you also have to understand how to teach to a diverse group of learners, understand how to, understand what your expectations are, making that clear for students. I think it's helpful when you have an assessment or an outcome that's measurable. That makes sense. You keep in mind what your goal is, and hopefully the different activities that you do help you get to that goal. So if there was something that I would change, it was making sure that we had competencies for faculty members moving into that space. One, looking to make sure that they have either proper educational training or support when they come into that role, and maybe perhaps mentorship or coaching in that new role. But then also making sure that individuals who are coming into the academic arena are prepared, that they have the know-how to actually manage patients, is more than just having a degree. but really having some evidence that they can do exactly what it is that they're supposed to be teaching. And that's across the board.
And going along with that, I agree with Kim, bringing in people who are prepared that are good patient managers of patients. But I also think, and this is just my bias with my background in education, I really think the one thing I would change is that there's a requirement that all faculty come in are required to take education courses, participate in some sort of educational training. And that's not just in PT. I think that's across the board, all healthcare. And in most professions, you can't pluck somebody out of the clinic and say, now come in and teach. And I think that's one of the biggest challenges that we face as faculty, because in mentoring faculty, what I find is that faculty don't know how to write exams, they don't know how to assess, they don't understand pedagogy or andragogy, so they're teaching the way they were taught, and it just doesn't always allow for a good experience, and sometimes it's a struggle. So I think if I had to change anything, I would say that all faculty would need to take classes or a training or 3 or 4 courses in education, like curriculum design, designing assessments, understanding basic, like how do you write a syllabus? What's the difference between course objectives and lecture objectives, and things of that nature. So that would probably be the biggest thing that I would change. The only other thing I would change is figuring out a way for students not have to pay so much for their.
Yeah.
The most common answer ever.
Yeah. So, but yeah, that would be, I think, if any of us could figure that out, we probably would do quite well.
No, I couldn't agree more. And I wanted to appreciate you both for those answers, because I think those are some really good points. And I love it how we're getting away from our more common themed answers and we're getting different ones that we hadn't heard of, because early on, we definitely got some answers more consistently than others, which was good because, it shows that's clearly an issue if it's being brought up more. But now that we're getting different avenues and different perspectives on different things, we're getting a wider diversity of answers. So that's something that I always appreciate, and there's always gets a different way of thinking about things or looking at things. So thank you both for that. And, I recognize that some of our listeners here might be listening and they might have a question regarding anything that we've talked about tonight. Where can people reach out to either of you, either online or through whatever platform is best for you, should they have a question?
Sure. Your listeners can find me at K Varnado with a V as in Victor, ARNADO @csm.edu. That's my email address. You can find me on Twitter at Kimberly Varnado @Varnado Kimberly. Also my Facebook page, Kimberly Varnado. I'm available there too.
For me, they can find me at kim.nixon-cave @jefferson.edu, or through my Gmail, kncave@gmail.com. I'm also on LinkedIn. I don't have Twitter and Instagram available, just by personal choice, but those are 3 ways to get in touch with me.
Well, perfect. And ladies, thank you again so much for your time, your service, and all that you both are doing for the profession and working on these issues. It's tremendous to be able to meet you both in person a few months back and reconnect again. So thank you both so much again for coming on, sharing your perspective, and good luck with everything else you guys got going on.
Thank you, Brandon. Thanks for having us.
No, the pleasure is all ours. Thank you both.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available in our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter @HET Podcast, on Instagram HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.